Hello, everyone. We'll be back to MedScenarios. So my name is Linda Namatovu. I'm in my year 5 currently at Makerere University, offering a bachelor's degree in medicine and surgery. I'll be discussing with you gender-based violence, its management, prevention, and also its effect on HIV prevention. So many a time when we talk about gender-based violence, we consider this violence to be mostly towards the women. And that's quite true because before we got this term of gender-based violence, the term which was being used was violence against women. So when you look at the UN declaration, which talks about the elimination of violence against women, it defines this as any gender-based violence that could potentially cause harm or is likely to bring about issues concerning physical, psychological, or sexual harm to a woman. So this can range in a number of ways that factor in issues to do with sexual coercion. It can factor in areas in which women's liberty is being oppressed, among very many other scenarios. However, in our world today, we've gotten to appreciate that even men can be victims of gender-based violence. So today we moved away from the term violence against women and we focus on gender-based violence, which encompasses both the women and the men. So right now, the umbrella definition of gender-based violence, we can look at it as any harm that is perpetuated to women or men on the basis of unequal rights between men and women. And this is against a person's will. So any act that is against a person's will can also be termed as gender-based violence. So now we're going to shift towards how gender-based violence can hinder HIV prevention or how it can create barriers towards HIV prevention. So we're going to look at mainly two aspects under this umbrella. When you look at gender-based violence, we shall find that victims of gender-based violence are more at risk of acquiring HIV. So this is in the line of, especially now I'm going to look at women because they're the ones who are most at risk of acquiring HIV through gender-based violence. So we shall look at their spouses. They'll want to carry out condomless sex or because of dominancy, like men, especially in African traditional society, in African setting, men have a sense of dominancy. So because of that, they will want to impose this onto the women and they'll be more predisposed to acquiring HIV, and it will still fall under the umbrella of gender-based violence. So the second aspect is adherence to their ART regimen. In many cases, victims of gender-based violence will find a challenge in adhering to their ART regimen because they'll have issues with disclosing their status to their partners. And then there'll also be issues of psychological torture and things like that. So they'll find a very big challenge to be able to adhere to their ART regimen. So we're going to move into a sector of screening victims of gender-based violence. When would you, as a clinician, suspect that this patient walking in may be a victim of gender-based violence? So we're going to look at mainly two umbrellas. The different service areas where we can screen patients for gender-based violence include the outpatient department, the inpatient department, at the ART clinic. When mothers working for antenatal care, you can also screen them. Even when you're doing maternal child health care services, you can screen patients for gender-based violence. So this is thus to say that each and every single encounter you get with a patient, you can always have your mind open. As a health worker, you should be proactive, and whenever you see pointers of gender-based violence, you can always screen these patients for the predisposing factors. So now we're going to look at the different areas of suspicion for gender-based violence, and this can include you looking at a patient and maybe they're having injuries. You can think, because some kinds of injuries can be marking more towards gender-based violence. And these injuries, based with the patient's history, they may not be really coherent. So you can think that this patient may be a victim of gender-based violence. Or patients who come in when they've experienced trauma, or when you receive a child who has malnutrition, you can suspect gender-based violence. or mothers who come in when they are having unintended or unwanted pregnancies, or even teenagers having pregnancies, people having recurrent STIs, UTIs. All these should be indicators and areas of suspicion for gender-based violence. Patients received within the art department can also be screened for gender-based violence following a number of parameters, and these include patients who are having challenges with disclosing their HIV status. You can maybe suspect them for gender-based violence. Patients also having issues with adhering to their regimen, those who are missing their appointments with either the physician or getting their art refill, and also patients who are having a non-suppressed viral load over a long time period. You could suspect that they are victims of gender-based violence. In addition, during HIV screening and testing and assisted partner notification, you can also mark out some indicators of gender-based violence as you interact with your patient. As a health worker, after getting a high index of suspicion that your patient may be a victim of gender-based violence, how can you go on with supporting them? So the World Health Organization came up with an approach known as the LIVES approach, in which you can support your patient who you suspect has been or is a victim of gender-based violence. So the LIVES is an acronym, and we're going to go through it. It is LIVES, where the L stands for listen actively. So when a client comes to you, you're going to take time and you listen to them carefully, and you give them enough time to express themselves. You're going to listen attentively, and you can also, with your body language, show that you acknowledge what the patient is saying. And then the I stands for inquire. You're going to assess this patient and try to understand what are their different needs. They could be emotional needs, they could be social needs, they could be financial needs, because many of these victims of gender-based violence remain in the places where they are because of these different needs that keep them trapped in that situation of being constantly in areas of violence. So you're going to assess their different needs and see how you can link them up to help. So the V stands for validating. You're going to validate the patient, show that you understand where the patient is coming from, and you are not posing any judgment towards what they're saying. You are understanding them and you believe their story. So from there, we're going to move to the E of the acronym, which stands for enhance safety for the patient. So your goal as a clinician is to ensure that you are protecting this patient from further harm. And the last part is S, which is support. You're going to link up this patient with the necessary support that they require to get out of the situation which they're in. So this would include linking them up to social workers or to maybe the encountering with the law in case they need to report these cases of gender-based violence. All right, so we're going to now move to understanding the gender-based violence screening tool, and it has different parts which you can fill in as a health worker. So this tool is going to help you to identify survivors of gender-based violence or persons who are undergoing gender-based violence actively at the time that you receive them. And the first part of this tool has the patient's demographics. Basically, you're getting to know the patient's name, age, sex, marital status, their highest level of education, because all of this can help you understand the patient better, and also there are different predisposing factors to being in a situation of gender-based violence. So after appreciating this, the first part of the tool is going to deal with the psychological or emotional violence. We're going to inquire from the patient, are they subject to threats, or is someone frightening them or insulting them? As we already appreciated from the definition of gender-based violence, it doesn't have to be only physical abuse. It could also be psychological abuse. So you find out, are they in a situation where they're being insulted, being frightened by someone? And the second part of it, you're going to inquire from this patient, are they in an area where they are being coerced into practices that could cause them stress or trauma? Yes, so you inquire this, any kind of practice, you inquire it from the patient, and they'll be able to let you know. Then you could also want to know from this patient, in case they have children, are they in a position where they are being restrained from accessing their children? Because this happens quite often in our setting, where a given parent dominates over the children and the other spouse may not even know that they are a victim of gender-based violence. If the person doesn't have a child, then you just know that this is not applicable and you move to the next part of the form. The second part of our tool has to do with physical violence. To inquire from a patient, are they in a situation whereby someone is maybe slapping them, choking them, hitting them with something, anything physical that is bringing about physical harm to the patient, and you note this down. And then you're also going to look at the sexual aspect, sexual violence. You would want to inquire from the patient, have they gotten any sexually transmitted infection that would be attributed to gender-based violence? Or have they been a victim of getting an abortion that could have been secondary to physical, psychological, or emotional trauma secondary to gender-based violence? Or maybe are they in a situation where someone is forcing them to have sex without their consent, or forcing them to carry out sexual acts that they are not willing to carry out? And then you also look at that sexual aspect of the gender-based violence. So to complete the screening tool of gender-based violence, you're going to finish it by stating the potential risk that this patient could be experiencing. This could include pregnancy. Maybe it is a teenager and they are being continuously sexually assaulted. They could get unwanted pregnancy or death if it's physical assault. Then you're going to note down the area where you are referring them to. Have you been able to offer them any help? And then the cadre of you, the personnel who is providing this service to them. In case you've affirmed that this patient is indeed a victim of gender-based violence, some of the few things that you'd like to do for them is examine them. In case they are victims of sexual abuse, you'll be able to examine them to find out some of the things that could be a marker to this, give them the necessary treatment that they are asking for or that they require. Then also do counseling for them because they're in most cases emotionally overwhelmed. Then you're also going to link them up to, maybe refer them to the legal support that they require. In case they're children who need child support, you can do this for them. Then also financial empowerment, if it is required. And also if you can link them up to social workers, you can provide this for them. Also do HIV screening and testing and give them emergency pills, let's say like they are teenagers or a person who doesn't want to get that unwanted pregnancy. You also give them this. Screen them for STIs and also any other issues that could be surrounding gender-based violence. The last part of our discussion today is going to involve us talking about the minimum care package for post-rape victims. In our setting, that is something that is quite prevalent, so we'd like to know how best to help out victims of rape. So when they walk up to you in a facility, you're going to do the initial assessment of the patient. This will be taking their history and also examining them. Then following that, you'll want to do a rapid HIV testing. And if this patient confirms to be positive, you're going to refer them and also give them the required treatment for that time being. If they're having any injuries, you treat them, then you refer them to services where they can get the necessary support based on their HIV positive status. Then if the patient is HIV negative, you'd want to give them post-exposure prophylaxis. And all patients, screen them for STIs and give them the necessary treatment that they require for if they've acquired any STI, give them the required treatment for that. In addition to that, the rape cases fall under the forensics unit, and if you are in an area with forensic services, then this patient will also have to undergo a forensic examination. And in addition to that, you would also want to give them the emergency contraceptive pill in case the patient has come 72 hours after the event, and also if it's legal in the area where you are practicing. Victims of gender-based violence will require the clinical services as we've earlier elaborated, and in addition, they'll require other non-clinical services, for example, continuous psychosocial support, considering that these patients may be undergoing emotional and psychological trauma, so they'll need support from time to time. Then also linking them up to the legal services. For example, if they need to open up, to meet up maybe with the police and to work out their different cases, you could help them out with that. Then also children may need to be under the Child Protection Program. And this could include children who require emergency out of family care. For example, if a child is being sexually assaulted by their only guardian, you may need to get them out of that situation to place them into another better area. And there could also be reinterrogation of care. This child can return to their family after some time. Let's say like the issues of gender-based violence have been aired out, they can be reinterrogated there. Or sometimes it may not be possible. There can be failure to reintegrate the child into the family care. So you may need to continually get them to a place where they can stay. In addition to that, we shall want to give these different victims economic empowerment, because as we shall get to appreciate, or as we've appreciated, many people are victims of gender-based violence because they are economically strained. Like they're unable to meet their different needs, so they end up being in a situation where they are victims of gender-based violence. Then there'll also be need for emergency shelters. As you can see, some governments have established shelters where individuals who are victims of gender-based violence can stay or harbor for a given time period and they feel safe. And also there will be need for. So today we've appreciated gender-based violence, and we've gotten to acknowledge that this doesn't have to do with only women, but however, even men can be victims of gender-based violence. So your role as a health worker is to have a high index of suspicion in case you encounter any patient. Do not put it at the back of your mind, but however, always think that they could probably be a victim of gender-based violence, and whenever possible, screen them and link them up to the necessary care. And in case you also get to know someone or you yourself are a victim of gender-based violence, do not hold back from seeking the necessary help, because so many establishments have been put in place to help you out to get out of this situation. Just know you are not alone. Thank you so much for watching today. Until next time, bye.
If you enjoyed this video, please give it a thumbs up and share it with your friends. You can also subscribe to our channel for more great content. And don't forget to follow us on Instagram, Twitter, Facebook and TikTok.